I'm Effie Singas, Program Director of North Wales Pulmonary and Critical Care Medicine Fellowship at North Shore University Hospital and Long Island Jewish Medical Center. Welcome to our program. Please review the content on this website, including videos from our Director of Graduate Medical Education, our Division Chief, our faculty, and current fellows. While we can't meet in person, we have tried our best to convey the unique culture of our program and health system during these presentations. Most importantly, we're all committed to supporting our fellows in their training and to helping them thrive and grow professionally. I look forward to meeting you virtually at your upcoming interview. Now, here's an overview of our program. I'm certain that you will find that this is a terrific place for fellows to train. Pictured on this slide are Long Island Jewish Medical Center on the left and North Shore University Hospital on the right, our two large tertiary care hospitals. Our fellows spend 90% of their time rotating through these two hospitals over their 3 years of training. Our division chief is Dr. Harley Greenberg, who also directs our sleep fellowship and clinical sleep program. Dr. Greenberg is a master physiologist, teacher, and clinician. It is no surprise that so many of our fellows go on to pursue sleep training, as he truly is an excellent mentor. I have been program director for greater than 15 years, and over that time, our program has evolved into one of the strongest clinical programs in the country. I hope that you will see that our fellows are exposed to the full breadth of pulmonary disease and critical care medicine. Our associate program directors are Dr. Ade Segay, who also directs the MICU at Long Island Jewish, and Dr. Anna Maria Iakovu, who directs the respiratory care unit at North Shore University Hospital. Hope Iger is our amazing program administrator, whom you will all meet on your interview day. Our chief fellows this year are Dimple Shah and Stanley Abraham, who have done an amazing job organizing our rotation and academic schedules. They have put together a comprehensive and informative website for this year's interview season. It's important to say a word about our health system, Northwell Health, which serves Long Island, Manhattan, Queens, Staten Island, and Westchester, representing a community of over 8 million people. We are the nation's 14th largest healthcare system and the largest in New York State. We are also one of the largest clinical medical education institutions in the country, with 1,900 residents and fellows and greater than 170 graduate medical education programs. Our health system includes 15 teaching hospitals that are listed on this slide. North Shore University Hospital and Long Island Jewish Medical Center are two of the major tertiary referral centers for this extensive network of hospitals. Patients are frequently transferred to our tertiaries from these community hospitals for specific procedures and subspecialty care, and when our intensive care units are required. We are also the primary teaching hospitals of the Zucker School of Medicine at Hofstra Northwell. Our first medical school class began in the summer of 2011 with an innovative and clinically integrated curriculum. We still maintain affiliations with Albert Einstein College of Medicine, SUNY Downstate, New York Medical College, and we have many students rotating from other hospitals in addition to these. The effectiveness of any program is dependent on its educators. Over the next few slides, I will tell you about our clinical educators and also invite you to read about them on our Northwell Fellowship website. These faculty are leaders in their clinical and/or research areas, and they play a major role in the training and mentoring of our fellows. I have already spoken about our division chief, Dr. Harley Greenberg. Dr. Abhinav Agarwal is our director of bronchoscopy and interventional pulmonology. He is a graduate of our program who went on to pursue training in interventional pulmonology at University of Chicago and now directs our IP program. Eric Gottesman directs our MICU at North Shore University Hospital, and his clinical interests include diaphragmatic function in critical illness and pulmonary disease. Dr. Aldo Iacono joined our faculty at the end of 2021 to direct our Northwell lung transplant program. He is a national thought leader in the field of lung transplantation and advanced lung disease, and he has made major contributions to clinical and scientific developments in lung transplantation. Dr. Iacono previously developed and led the lung transplantation programs at the University of Pittsburgh and the University of Maryland. Dr. Anna Maria Iacovu, also a graduate of our pulmonary critical care medicine and sleep programs, is our associate program director, and she directs our respiratory care unit at North Shore University Hospital. Anna Maria has been instrumental in the development of a case-based curriculum in pulmonary disease for our fellows. Dr. Jonathan Illowhite is an expert in diseases of the airways, and he directs the care of patients in our asthma center. He has served as principal investigator in greater than 75 clinical research trials and has authored over 50 peer-reviewed publications. Dr. Gita Lisker, also a graduate of our program, directs our respiratory care unit at Long Island Jewish and is the founder and director of Northwell's Crown program. The Crown program was developed to take care of high-risk COVID patients with a novel telemedicine hospital-at-home program so that these patients can stay in the ambulatory setting. Dr. Mayo is a world-renowned intensivist who has pioneered the use of point-of-care ultrasound and echo in the ICU. He is on the National Committee advocating for standards and guidelines in its use, and he was a major leader advocating for board certification in critical care echocardiography. Dr. Mayo is also our academic director for critical care and leads many of our educational conferences. Dr. Mangala Narasimhan is the Senior Vice President for Critical Care at Northwell Health and the Director of our Acute Lung Injury Center and VV ECMO program. She is an amazing clinician and educator who has won many teaching awards over the years. Dr. Harry Steinberg is our founding division chief, master clinician whom fellows love to work with in clinic. He is known for his clinical pearls and for taking care of patients with rare and interesting pulmonary diseases. He is a recipient of the Lifetime Achievement Award from the Long Island Jewish Medical Staff Society. Dr. Aranab Talwar is the director of our Advanced Lung Disease and Pulmonary Hypertension program, and he is recognized as an expert in the care of these patients. He also directs our Pulmonary Function Lab and our rehab program. Our fellows work with him in Pulmonary Hypertension Clinic and in our PFT lab, where our fellows learn pulmonary physiology. Dr. Ade Segay, our Associate Program Director, directs our medical ICU at Long Island Jewish Medical Center. She has created a critical care curriculum for our fellows, and she attends primarily in our MICUs at North Shore and LIJ. Her clinical interests include rapid response teams and airway management. Dr. Janice Wang directs our Cystic Fibrosis Center, and her research interests include drug trials, lung transplant, palliative care, and support groups in cystic fibrosis, investigational use of anticoagulation and alteplase in COVID-19, and non-tuberculous mycobacteria. You will learn more about the CF Center later in this presentation. The asterisk that I've included after our faculty names indicates that these faculty members are a graduate of one or both of our fellowship programs. I have listed additional clinical faculty here, many of whom include graduates of our own pulmonary critical care and sleep fellowship programs. They attend on our consult services, in our ICUs and respiratory care units, our sleep clinic, and in our sleep lab. Several have gone on to assume leadership roles, and we are very proud of all of them. Please read about them on our website. In addition, we have clinical faculty based at LIJ Valley Stream Hospital who regularly rotate through North Shore and Long Island Jewish Medical Center to attend in our MICUs, consult services, and respiratory care units. The chair of medicine at LIJ Valley Stream is Dr. Gul Zaidi, who is also a former fellow and chief fellow in our program, who continues to attend regularly in our medical intensive ICUs. In addition, Lisa Chen, Ayelet Hilowitz, and Alex Melamed are also former fellows who trained in our program. Similarly, we have faculty based at Plainview that attend on our clinical services at North Shore and Long Island Jewish. Dr. Sienna Moran is the medical director of the ICU at Plainview Hospital. Craig Fryman and Mina Macarius, both graduates of our Pulmonary Critical Care Medicine Fellowship, attend 50% of the time at North Shore and LIJ, in addition to attending at Plainview Hospital. Lisa Santoriello and Jennifer Larson are both graduates of Northwell's IM/EM Critical Care Program, and Lisa is currently the program director for that program. As you can see, there is a strong tradition of mentoring in our fellowship. Many of our fellows have stayed on to become faculty. Because our health system is growing, we are able to offer our graduate fellows jobs after they complete their training. We also have intensivists in both of our MICUs 24/7. They include the faculty that are listed here. Our fellows do not take in-house night call. Call is primarily for the pulmonary service. During the pandemic, when our units were overwhelmed, our fellows were called in to work, and they all came in very readily to help their colleagues. Training locations include the consultative services at both hospitals, our bronchoscopy suites, our respiratory care units. The respiratory care unit is a step-down unit for patients recovering from critical illness who still require ventilator support. And our fellows also rotate through the various intensive care units. There are mandatory rotations in the surgical ICU, the neurosurgical ICU, our cardiothoracic ICU and ECMO unit, and there is a mandatory rotation at Queens Hospital Center where fellows spend 1 month caring primarily for patients with tuberculosis. The CCU and the telemedicine EICU are elective rotations in our program. Our outpatient facilities are based at 410 Lakeville Road and include our continuity clinics, our faculty practice, our pulmonary function lab, and pulmonary rehabilitation program. Our sleep lab is based on Community Drive across from North Shore University Hospital. And we also have our Tobacco Control Center, which runs highly successful smoking cessation programs. Our Center for Learning and Innovation includes our Simulation Center, also known as our Clinical Skills Center, the Patient Safety Institute, and our BioSkills Center. Every year during boot camp in the first 2 weeks of July, our first-year fellows spend a morning at BioSkills where they learn to perform procedures on cadavers, including percutaneous tracheostomy, chest tube placement, indwelling pleural catheter placement, and IOs. We have our own simulation room at LIJ for airway training, vent management, and mock codes, but our fellows have served as instructors during ultrasound courses at the Center for Learning and Innovation for our medical students and hospitalists. Research is a very important aspect of our fellows training. Every fellow is expected to have a project by 3rd year and a mentor, and our fellows are encouraged to present their research at national meetings. and they receive a yearly stipend to attend these meetings. Please review our academic website where you will find a list of publication from our fellows and faculty over the past year. You will see our fellows' names on these publications in bold print. I have also included a link to the Feinstein investigators so that you can see the type of research being performed in the Department of Medicine. The Feinstein Institute for Medical Research is in the top 6% of all institutions receiving NIH funding. Expertise exists in bioelectronic medicine, autoimmune diseases, sepsis, neurodegenerative and psychiatric disease. The Feinstein also sponsors the Elmezi Graduate School of Molecular Medicine, which awards PhDs in molecular medicine. We also have an affiliation with Cold Spring Harbor Laboratory, which sponsors world-renowned cancer research programs. One of our fellows a few years ago worked with researchers at Cold Spring Harbor, looking at the role of neutrophil extracellular traps in vaping-associated lung injury and in COVID pneumonia. He has co-authored several publications on those topics. Next, I would like to highlight our areas of clinical expertise. I have listed them here, but I will discuss each of these programs in greater detail over the next few slides. These areas include our Cystic Fibrosis Center, Beth Thalheim Asthma Center, Pulmonary Hypertension and Advanced Lung Disease Center, Sleep Medicine, Interventional Bronchoscopy, Critical Care Ultrasonography and Echocardiography, ECMO, lung transplant, and non-tuberculous mycobacterial lung disease and bronchiectasis. During their clinic week, which you will learn more about during the Chief Fellows presentation, fellows work with faculty in all these subspecialty areas, with the exception of lung transplant, which at this time is an elective rotation for our fellows. Our Cystic Fibrosis Center is accredited by the Cystic Fibrosis Foundation. We are also a member of the Therapeutics Development Network, which means that we receive funding for clinical trials. To date, we have over 100 adult cystic fibrosis patients. The Cystic Fibrosis Care Team is led by Dr. Janice Wang and includes a nurse practitioner, nutritionist, social worker, respiratory therapist, research coordinator, mental health coordinator. It truly takes a village to care for patients with CF, as their condition is complicated and their needs are often very great. I have listed some of the research that Dr. Wang and her team are involved with. Our CF team received the Cystic Fibrosis Foundation Award for innovations in palliative care for a pragmatic implementation trial of a CF primary palliative care intervention. This will address common problems in CF patients, including caregiver burden and practice support for providers. We are also involved in the CF lung transplant transition learning and leadership collaborative with Columbia and Dartmouth to improve process for transfer and transition of people with CF to lung transplant programs. In addition, we participate in pharmaceutical trials with CFTR modulators, new inhaled drugs, and anti-inflammatory agents. Our Beth Thalheim Asthma Center team includes a nurse practitioner, pulmonary function lab technicians, our rehab program, and researchers. We provide comprehensive diagnosis and treatment of patients with asthma, and we're involved in several industry studies, including the newest monoclonal antibody therapies. Our pulmonary hypertension and advanced lung disease program has a clinical registry with greater than 1,500 patients. From this registry, fellows have participated in greater than 50 publications and presented at national meetings. Our clinical program includes a nurse practitioner, several researchers, our PFT techs, rehab therapy under the supervision of Dr. Talwar. Our fellows work with Dr. Talwar in his clinic, learning about the workup and classification of patients with pulmonary hypertension, and they learn how to treat this complex condition with the various medications that are now available to us. Dr. Talwar has been a recipient in the past of the New York State Empire Clinical Research Program grant 3 years in a row. He also had received an NIH grant to study macrophage inhibitory factor thyroxine interactions in patients with advanced lung disease, and he participates in several industry grants. Our Sleep Disorders Center hosts an ACGME accredited sleep fellowship program. We run a didactic curriculum for our pulmonary critical care medicine fellows in sleep that occurs weekly, and this curriculum is for the sleep fellow, but all of our pulmonary critical care medicine fellows participate in this as well. We have an 8-bedded AASM accredited sleep lab, and we have at least 8 faculty members that are active in sleep medicine. We participate in state-of-the-art therapy, including hypoglossal nerve stimulation for obstructive sleep apnea, the so-called INSPIRE therapy. And we are also participating in sleep apnea screening and treatment for the MTA, which is the largest public transportation authority in the nation. Most of our sleep fellows have been recruited from our own Pulmonary Critical Care Medicine Fellowship, which is a great opportunity for any of you that are interested in sleep medicine. Interventional bronchoscopy is an exciting growing area in our program. We have bronchoscopy suites at both North Shore University Hospital and Long Island Jewish Medical Center. We perform EBUS, robotic-assisted navigation bronchoscopy, rigid bronchoscopy, argon plasma coagulation, cryotherapy, electrocautery, balloon bronchoplasty, stent placement, and endobronchial valve placement. In addition, Dr. Agarwal and our fellows perform medical pleuroscopy, tunneled pleural catheter placement, and percutaneous tracheostomy in our bronchoscopy suites. As we do not have an interventional training program, our pulmonary critical care medicine fellows get to perform all of these procedures under expert faculty. Our fellows graduate our program with greater than 120 bronchoscopies logged. All of our fellows are certified to perform EBUS by the end of their training. In terms of critical care ultrasonography and echo, we have several faculty that are national leaders in ultrasound training. This is an integral part of rounds in our MICUs and on our pulmonary consultation services, and it is the area that our program is best known for. Our fellows store their images on QuPath for review during our conference, which occurs weekly. Our fellows are so good at ultrasound and echo that they teach at regional and national courses. Our fellows also undergo dedicated training in echocardiography and transesophageal echo. And several fellows have certified in echocardiography boards. I think we are one of the very few programs in the country that actually trains fellows in transesophageal echocardiography. And this is under the expert guidance of Dr. Paul Mayo and our other critical care faculty. Our ECMO program treated its first patient in 2017. Since then, we have had greater than 500 referrals for acute lung injury. Over 150 patients have been placed on VV ECMO, and our survival to discharge or transfer for lung transplant evaluation is comparable to ELSO registry data. The director of our lung transplant program is Dr. Aldo Iacono. Dr. Iacono was instrumental in creating successful transplant programs at the University of Maryland Medical Center, where he was prior to coming to Northwell, and at University of Pittsburgh prior to that. We collaborate with lung transplant cardiothoracic surgeons and pulmonologists, and this represents a collaboration between the departments of CT surgery, the Division of Pulmonary Critical Care and Sleep Medicine, and Northwell's Lung Institute. Our patients are referred from our Interstitial Lung Disease Center, from our COPD Center, Pulmonary Hypertension, and Cystic Fibrosis Centers, as well as from many other hospitals in the region. Our first transplant was performed in February of 2022, and to date, 21 transplants have been performed. One of our newest centers is the Non-Tuberculous Mycobacterial Center, which I co-direct with Dr. Marcia Epstein, the Chief of Infectious Diseases. This center developed out of a collaboration between several faculty in the pulmonary and infectious disease divisions. We are a member of the National Bronchiectasis Research Registry that is sponsored by the COPD Foundation. We have a monthly management conference where we discuss our patients, and we have also started to participate in therapeutic trials. There is a tremendous camaraderie between our fellows and the faculty, which leads to excellent care of our patients. These photos were taken during the pandemic, where faculty and fellows worked side by side to care for an unprecedented number of critically ill patients. And I have to say that the best part of our program is our fellows. They are truly a joy to work with and a pleasure to train. Here you see a group of fellows at a gathering earlier this year. Pictured here, you see our entire group of fellows at this year's graduation, which took place at one of our local restaurants. And here you see the entire group of faculty and fellows at graduation. This is a slide of our current first-year fellows during their boot camp training. And you can see our chief fellows, Stan and Dimple, in the foreground there. They're having a good time with our new simulator. And I'd like to conclude by thanking all of you for your interest in our program. I look forward to meeting each of you on your interview day. Take care and be well.